Thank you so much for staying with Citizen Weekend. Once again, our SMS number this evening is 22422, or you can use the hashtag #1on1. We continue with empowering women out there in our Women in Leadership segment. And tonight in studio, I'll be hosting Dr. Susan Musyoka, who is the Women's Rep, Machakos County. She is a University of Nairobi trained medical doctor, and she's no stranger to politics, as this will not be her first time to contest a political seat. Rather, 2013 was not her first time to contest for a political seat. She unsuccessfully contested the Machakos parliamentary seat in 2007, but come 2013, she was successful and was elected as Women's Rep Machakos County. Apart from her private job in the town where she operates a medical center, she has served in different public capacities, including a medical career spanning over 20 years. Thank you very much for joining us tonight on Citizen TV.
Thank you for having me.
Yeah, let's begin with, first of all, Ovawaku. I believe we come from the same place, so how are you doing?
Very well.
Very welcome to Citizen TV. So you have over 20 years experience in the medical field. Why the transition to active politics?
Yes, I have. I've been actually about 30 years in the medical field, and have been practicing in Machakos. And most of my patients have been poor patients who have not been able to pay bills, and who other than their medical reasons for visiting me, they would come with various other issues. Like issues of broken marriages, children who could not go to school and needed school fees, and harambes, and so many issues, poverty related. And also I thought other issues were issues that could be handled if I put myself in a leadership position and tried to get involved in policy making. So
this was when you were practicing at the Machakos General Hospital?
No, I practiced at the Machakos General Hospital and then left and started my own private practice. In the private practice, this is when I encountered so many of patients who could not, who had other challenges.
What's your area of specialization?
Public health.
Public health.
Yes.
Okay. So why Women's Rep? We know in 2007 you vied for a position as the area MP unsuccessfully, and then which area MP, by the way?
Machakos
Town. And then and then recently now Women's Rep, an elective position. Why in particular the Women's Rep position?
Yes, that's a very good question. The political field is not easy for women. So in 2007, I vied, and I had about 5 other men contesting as well. And many times they would gang up together against me, as like I was the enemy. And it was really tough. And also, my agenda was really women. So when the women representative post came along, I said I want to try. And because I feel that as women, we need to be in leadership. We need to air the issues of women, youth, persons with disability. So I felt that this is where I should belong, and I should be able to articulate issues that I come along in my practice.
And as you talk about women needing to vie for elective positions, would you describe yours as a landslide victory? Who was your stiffest competition? I know when we look at Ukambani politics, there's not a lot of women who really stand out. We know there's been Wavinya Ndeti, there's Charity Ngilu, but women seem to be shying away from politics in the entire Ukambani region. I may be corrected. But for you, was it a landslide victory, or did you have somebody that came very close to?
In 2013, I think I had a landslide, because I had more than 200 votes, and the person who followed had 80,000. And then the ones after that had around 20,000. So And
this was under the Wiper Democratic?
Under the Wiper Democratic Party.
Okay. So you visited Jacqueline Mwende, whose limbs were chopped off by her husband, allegedly by her husband, at her family's home in Kathama village, Masi. What help is there currently at county level for victims of domestic abuse? We know that in the rural areas, when a woman is perhaps beaten by her husband, the first person she will go to seek help from is the chief. So has there been anything in terms of improvement of places where women can seek help at county level?
First and foremost, I think having women in parliament has helped a bit, because we spearheaded and made sure that the gender-based violence law was passed, and it is now being enacted. And we are working together with FIDA. And FIDA is giving us all the legal advice and lawyers to stand by such victims. And not only that, FIDA is also training women to be able to defend themselves. And we have a good partnership. And we have also been very much involved in the 16 days of activism and training and enlightening women to report cases of violence.
Are they rampant? Because we know the case of Mwende was one of the extreme ones, but you said that a lot of times you would be interacting with your patients and they would tell you what they go through. How rampant are cases of domestic violence in the country?
They are rampant. In my practice, I would see quite a number, and surprisingly, I would see them, treat them, fill in their P3 forms, and later on they'll come and say, let's forget about the case. He's the father of my children, so I want to live with him. So women are always shy to take the case forward. Now, with extreme cases like Mwende's, and also others that are coming along, we need to stand up and say no to violence against women and children and defilement, and because they are there. And many times when you go report these cases to police, you get ridiculed. So we need also the police to be trained and to be more friendly and more caring when such cases are reported to them.
Let's talk about healthcare, and I believe this is something that's close to your heart, being in the field. The recent doctors' strike, and this has been perennial. It's been reported severally in the county. What action has been taken, and is the return to work formula going to work this time around? What are the issues, just briefly?
That is my wish. I hope that this time that the formula that they came across is going to work. First and foremost, it took 3 weeks of doctor strike in Machakos. That is very, very unusual and very unacceptable. The efforts that doctors made to speak to the governor, to speak to the government of Machakos, would end up in disarray, and nothing would happen, and they would still continue on strike. There was the issues of money, issues of lack of drugs in the hospital, lack of some of the equipment, and also interference by the government officials as the doctors went to work.
By the national government? Or
no, the county. So the doctors were not working freely. And another mistake that was made, this is now national, because everywhere we have strikes. I think in the medical field, we made a mistake not to fight for the health care to remain at the national level. Health care was devolved all at once, even before the governments in the counties had settled. And with the money transfers and issues, you find that the smooth transfer of funds and payments are not done properly. So doctors have to wait for their salaries, and sometimes the remittances of NSSF and HIF is not done. and then you are not comfortable to work and to deliver the services.
So back to resolving, you know, perhaps stalemates when it comes to such strikes. How has the rivalry, this is coming in from the viewer, how has the perceived rivalry, quote unquote, between Senator Muthama and the governor himself, Dr. Alfred Mutua, affected development issues in the county? Because this is seen as, the bulk of messages that are coming in are seen as one of the major issues, is seen as one of the major issues that's affecting development issues in the county.
I must say, right from the word go, there has been that rivalry between the senator and the governor. But the governor is the CEO. He is in charge of the county. He has the resources. So really, well, even if the senator is talking, he should be able to implement the work that he's supposed to do, and ignore. But I don't think he has also tried to work with other leaders, because I, for instance, have not been able to get across to him on many issues.
Right. And as we talk about the top position, the CEO of the county, you talked about women shying away from elective positions, Mheshimiwa. So I want to talk to you about your plans for 2017. Would you, for instance, dare to go for the top position, which is the gubernatorial seat?
Well, I would, but the limiting factor for most women is funds. Because the bigger the seat, the more funds that are required in vying for the seat. We have Honorable Avinya, who has been trying, and I'm sure she would have done a better job if she was the governor of Machakos. Women have a way of handling issues in a different way, in a better way, and accommodating people, accommodating different sorts of types of people and issues. And I'm sure the county of Machakos would be a better place.
And let's talk about, you know, stereotype that holds that Machakos is a very dry place. There's the water problem, which the governor has addressed, and we must applaud him for that. Let's talk about the woman of Machakos County and what issues she is dealing with, and how you, as their representative, has been able to empower them or even to improve their standards of living.
Water is still an issue, a very big issue in Machakos, and we would like to see dams, more dams being done, and I would like to see a lot of. The governor promised about 800 boreholes, 800 dams. He hasn't done as many, and if that could be done, and we, especially the dams, where we could collect water, and small dams across each rivers. We have the river going through Machakos. If we had a huge kind of like a lake in at the river, and the plan has been there for the last 40 years around Thwake area. If that could be done, it would help. It could go a long way to help solve the issue of water in Machakos.
Okay. For the woman of Machakos County that is watching you, what are you most proud of as regards your position and what it has allowed you to do for that woman?
For the woman of Machakos County, I can say that one of the things we've been able to do is in legislation. We've been able to pass, like the GBV law, the marriage bill. We are actually going to amend the Sexual Act, and also I can say that we have challenges as women representatives, because other than legislation, really we do not have like CDF, or we have an affirmative action fund which came the other day.
Yeah, because all the other women's reps that have come to studio before say the funds are a major issue.
Yes. That
you are limited because of how much money is allocated to you.
What is allocated is peanuts. But we've been working with it in terms of advocacy. We've been training and encouraging women to stand out, to get out of and to have skills so that they can compete better in positions. And we've also been trying to bring, like today I distributed several checks for the women to be able to do table banking. But again, table banking is a small activity and it can go a long way if it is done properly. But I would like to see more funds that are accessible to the women, because once women get funds, they are able to do businesses and to improve themselves in their homes and improve families. Somebody is sending in a very controversial question here, and they're saying as the election approaches, a lot of politicians are pulling all stops for their campaigns, or rather ahead of their campaigns. And you were criticized recently for branding sanitary pads, which you donated to girls in schools in your county with your face and title. So somebody here is saying, yeah, how noble an act is that to brand sanitary towels with your face and title? Well, branding, that is, I don't see the issue there, because we brand things so that they are not sold in the market. Because if you just give them and there's no way of showing that this was freely given, they'll land in their shops and people will start selling them. And I must say that that exercise of sanitary towels was very well received. So many schools said, I am God-sent. They're so happy that I was able to supplement the little that is given by the government. And even today, they are calling me, when are you coming to our school? Have you forgotten our school? So it's really something noble. And is the issue of sanitary towels in school? Yeah. They are actually lacking sanitary towels. The ones that the national government gives are not sufficient? They are not sufficient. We are doing this as a supplement. And the girls miss like 4 days a month because of monthly periods, and that is not acceptable. And I'm also in a committee, in a caucus, where we are pushing for use of evidence in decision making. And we are also pushing for the use of evaluation and having the SDGs. You know, we had the MDGs which came and went. As the SDGs get implemented, we would like to see no one being left behind. We would like women to be involved in every aspect of development in our country and even in decision making all over. So if we are not equal, like in school, if I miss school, if a girl misses school 4 days, the boy will do better. So we need to have, instead of having a negative attitude towards that, we need to look for ways of bringing some kind of equality and making people at the same footing. Okay. And as we close, Honorable Susan, just you know, a word from you to your constituents. I think the issue here, and this is what's coming in from our viewers, is that a lot of you are not known. So we're so happy that you made time to come to our studios this evening. So just a word to your constituents, to the women who are looking up to you. First of all, you didn't quite answer my question. Are you going for the same seat in 2017? Do you have other plans? Do you want to go back to medicine? What's your plan? I want to go for the same seat come 2017, because I feel I still have a task to do, and the small fund that has come, I've just started implementing it, so I feel that I should be given a chance to continue with the work that I've started. What do you want to tell the women of Machakos County? I want to tell the women of Machakos County not to shy away in issues of leadership. As I sit in Parliament, I find that what a man can do, we can do even better, but once given the chance. So we should put our best foot forward and go for it. MCAs, women representatives, even gubernatorial seats, we should try and vie. Okay. Yeah. Thank you very much for your time. We've been talking to Honorable Susan Musyoka. She's the Kind Women's Representative at Machakos.